Good afternoon, Hanson Patrick. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Good morning. My name is Hanson, and I'm one of the nurses here. May I know your name, please?
My name is Mihiraa.
Mihiraa, could you please confirm the reason for your visit today?
Yes, I've had this spot on my forearm for a while, and it doesn't seem to be healing, and it sometimes gets a bit flaky. My doctor said it needs checking. So I am here for a skin biopsy.
Thank you for the confirmation, Mihiraa. To help me plan your care, have you ever had a skin biopsy done before?
No, this is my first time. I'm not really sure what to expect. So I'm a bit nervous, to be honest.
That's completely understandable, Mihiraa. It's normal to feel a bit anxious when something is new. My role today is to prepare you for the skin biopsy, explain everything that will happen, and answer any questions you have along the way. Now, let me walk you through what the procedure itself involves step by step. It's a very common and straightforward process. First, we will carefully clean the skin on your forearm with a special antiseptic solution to ensure the area is sterile. Next, I will inject a local anesthetic, a numbing medicine, around the lesion using a very fine needle. The main sensation you'll feel is a brief sting or pinch from this injection. Once the area is fully numb, you should not feel any sharp pain. The doctor will then take the sample. They typically use one of two gentle methods, a punch biopsy, which uses a small, circular tool to remove a tiny core of skin, or a shave biopsy, which gently removes the top layer. During this part, you might feel some pressure or a sensation of pushing, but it shouldn't be painful. From start to finish, the active part of the procedure is usually over in just a few minutes. In terms of reassurance, it is considered a very safe procedure. However, with any minor procedure, there are small, manageable risks, such as a little bit of bleeding, potential for a minor scar, or a slight risk of infection. Please know that we use sterile techniques, and will give you clear aftercare instructions to minimize these risks as much as possible. Does that help paint a clearer picture of what to expect?
Okay, that sounds more straightforward than I imagined. What happens to the sample after?
I'm glad that helps clarify the procedure for you. Now, Mihiraa, let's talk about what happens after we take the sample, as that's a very important part of the process. The small piece of skin is carefully placed in a container and sent to a specialist laboratory. There, a doctor called a pathologist, who is an expert in examining tissue, will analyze it. They will look at it in great detail under a powerful microscope. Sometimes, they apply special dyes, known as stains, to the tissue. These help highlight specific cells or structures, which is crucial for identifying the exact nature of the condition. This detailed report is what provides your dermatologist with the precise information needed to understand what's happening. This leads me to a very important question I need to ask before we go any further. To ensure the analysis is as accurate as possible, are you currently using, or have you used in the last few weeks, any creams, ointments, or other treatments directly on this spot?
No, not now. Actually, I've been trying an over-the-counter hydrocortisone cream for the last couple of weeks, hoping it would clear up. After consultation, doctor told me to stop using it and to have the test.
Thank you for telling me that, Mihiraa. That's very helpful and important information. I'm glad your doctor advised you to stop the cream. The reason this is so important is that topical treatments, like the hydrocortisone you were using, can change the skin's appearance. They can reduce redness, swelling, or scaling. While that might seem good, it can actually mask the true microscopic features of the lesion. This means the pathologist might not see the full, clear picture under the microscope, which could potentially compromise the accuracy of the results or make them harder to interpret. Your doctor gave you excellent advice to stop it, as it gives us the best chance for a clear and reliable biopsy result. It's very good that you mentioned it.
I see. So, based on what you see, is it serious? What's the treatment going to be?
Mihiraa, that's a very natural question to ask. My role is to assist with the procedure and provide information, but I can't give a prognosis or a diagnosis. That's exactly why we do the biopsy, to get a definitive answer. The results will provide the dermatologist with a clear information they need to decide on the most accurate diagnosis and the best treatment plan for you.
Okay, that makes sense. How long will it take to get those results?
Typically, the results take about 1 to 2 weeks to come back from the lab. Mihiraa, once they are available, you will have a follow-up appointment with a dermatologist or your referring doctor. They will sit down with you, review the full report, explain what it means, and discuss all the next steps.
Right. And do I need to do anything now?
Before we go any further, Mihiraa, I need to check your consent. Now that I've explained the procedure, the cleaning, the local anesthetic, taking a small sample, the analysis in the lab, and the follow-up for results, do you have any other questions or concerns?
No, I think you've covered everything clearly.
In that case, do I have your permission to go ahead and prepare you for the skin biopsy today?
Yes, that's fine. You can go ahead.
Thank you, Mihiraa. Just to summarize our discussion so we're both clear, you're here for your first biopsy of the persistent lesion on your forearm. We'll numb the area, take a small sample, which will be sent for detailed microscopic analysis, and we'll note your use of the cream. I've explained that I can't give a diagnosis, but the results, which take about 1 to 2 weeks, will be reviewed with you in a follow-up appointment. And you've kindly given your consent for us to proceed. Is that a fair summary?
Yes, that's everything. Thank you for explaining it all so patiently.
You're very welcome. I'll now get everything ready, and the doctor will be in shortly. Just relax here for a moment.